Hello. Hello, everyone. Thank you for your patience uh, and coming in today. It's a beautiful day today. We have a 1 hour for this AMA, and there's been pretty much we've been just getting everything done, our legal disclaimers and everything ready to be uploaded to the new site. I added some things to our master plan document, which is not on the actual demo site that the community has seen and has been using, but it will be on the upload. We should have that done probably by the end of the day today with our legal disclaimer. We should have it today. Today was the due date for that. Then we'll just upload those things to the site and get it up on our online, publish it. So that should be done soon. I've been mostly working on the companies that we're looking to acquire and looking at new targets, mostly focused on production, just so we can produce in different regions. And that's, there's been different types of companies that I've looked at, from pill production to injectables, and that's what we've been doing just to put everything together. We have a planned launch date. As I'd mentioned in the previous AMAs, we're going to do a nationwide launch pre-listing. So it will be within the next 90 days or less in the U.S. That's with full services running, marketplace, and blockchain hashing on the apps. And so Tanya and Dr. Itzel, Anthony, everyone's been working on preparing everything for the launch. We've been looking at the new screenshots for the new app. I showed the community our user interface for the new app. I think I showed it in one of the AMAs, and I also uploaded a GIF. It's basically the same thing. It's just graphically a little bit different. I think it looks cleaner as it is now, but we will show it to the community. And pretty much, we've just been focused on getting these things done as fast as possible. We have to get everything wrapped up from the investment side as well. We're about to do our filings. So after that moment, the link that has been shared will be taken down and will not be active for those who want to come in with the convertible note. It doesn't mean there won't be an opportunity to invest again, but it won't have a conversion price that's so low. There will be one more opportunity at a higher price per share once we do our filings. So I'm going to go ahead and look at some of the questions from the community and answer them. I've been trying to catch up on some of the messages. I see there's been a lot of activity going on, and that's amazing. Let's see. Looking at the first question here, will DocChat eventual version of the working app have a CPR coaching possibility to alert possible medics in the area to respond to and assist in a medical emergency? Ooh, that is a great suggestion. That's actually a really good suggestion. I'm going to add that suggestion to the list of things for the team to look at. Can add it right now, might as well. See, these are the kinds of things that I think is very valuable to add, and we could definitely do these kinds of functionality additions. So any suggestions from the community are really valuable things. We don't want to be considered an emergency service, but I think something like this would be a valuable feature to have. So definitely worthwhile to do something like this. At the moment, like I've stated before, the functionalities will be the telemedicine calls, one button press telemedicine call, purchase of products on the marketplace with home delivery, and blockchain hashing. So those are three main functionalities that are being achieved with the new version of the app. There's also functionalities that are not user dependent, like the content and ads during the waiting period, but that's also part of being what's in the new version of the app. But from a user experience standpoint, they can press a button and access a doctor, press a button and access a psychologist, purchase their products, and have them home delivered. That's the baseline functionality that has to be achieved. But there's lots of other amazing things that we have on the list, and we'll be pushing out features after this launch. Let's see. I'm looking at other questions here. Okay, yeah, I see that some people have seen there's a mix-up with the ticker of the token and other companies who use the MTC ticker. I'm pretty sure that'll be very quickly cleared up with the next stage of marketing PR that we'll be doing, and with the change to the life chain. So the problem is you can't, once a smart contract is created, there's no way of changing the ticker name. So we'd actually have to create a whole new ticker, which would be great to have DOC, but we would have to create a whole new ticker, a whole new smart contract. So for now, it'll just stay MTC. Let's see. Looking at additional questions. Any update on the LifeChain creation, MTC to share swap for those who have pressing interest? Well, we're working on the LifeChain creation. It should be done in 60 days or less, with everything set up and its own website. And that's pre-listing, and there will be a solution for those who are interested. Ultimately, we have to ensure that whatever investment comes into Doc.com is done through fiat currency, just particularly because the regulations in the US, we have to keep it clean that way and correct that way. It doesn't mean that there's not an opportunity to make that change, but it has to be done in the correct way. So let's say LifeChain creation is step one. Step two is the LifeChain will offer let's say an exchange to fiat or to purchase. And then the user who does that will have fiat in their hands. Hold on. Just had a thing happen here with my headphones. So once that happens, the user has fiat in their hands, and then they can go ahead and invest through a investment document such as a convertible note into Doc.com. So that's kind of how it's planned out. It just has to be done the right way, so we don't. So we have it, as best possible for regulatory concerns, and nothing is holding us back. But that will happen relatively soon. Daniel is helping me with that directly, and it's planned to be set up in the UK. The LifeChain is. So we still have to put together some things, but it's definitely going to be relatively soon, and it's something that's working. So those who were expressed interest with the previous offer that we offered in 2022, um, which we can't go about how we originally intended to, unfortunately, because of the legal constraints. Um, but those who expressed interest will have a solution, and that's how the solution is planned to be executed. Will those participants of the swap get the price of 75 cents? Actually, it's different. The pricing for that was established back in 2022, and it was based on I think it was 3 times the trading price. That's how much it was. So it'll be based on that particular exchange rate, I would say. Uh, so that's this could change. Then again, this could change, but everything we do is reviewed to be compliant and correct moving forward. So um, I would say probably the best thing would be just to maintain the original pricing offer, which was 3x um, trading price. Let's see. Looking at, I just got back from. I had a trip to Los Angeles actually. This past week, I got back the day before yesterday, and I spent these days with Jamie Freed, as many of you have uh, heard me talk about him, and we've built really an enormous PR machine, uh, bigger than I've ever been a part of in all my life. Even with the enormous amount of PR marketing that we did back in 2018 and 2017, it's no comparison to what's been built now. There's also 3 new team members that have been integrated that came through Jamie. One is Dawn Miller. Uh, she is very, very renowned publicist and someone that's very excited to be working with us. And there's also a couple of new people from the development team that are working on right now. So we're even working on the weekends. So for me, I don't. Sometimes I'm like, well, what day is it? It's because days go by so quickly because even the weekends we're working. But this weekend I was able to spend it with Jamie in Los Angeles, and it was a great trip. And we had lots of talks about the things to come, the planning that we need to do. And I think we're moving very cautiously with everything and ensuring that we don't spend any funds on anything that won't create more additional value. But there's a high probability that we'll also have an office in Los Angeles, just because of all the celebrity involvement and everyone that can help us get the word out over there. So we went to look at some places, just drove by really, and it just seems to be like there's both, the whole aspect of the PR machine that you get in a place like Los Angeles. Sometimes it's just easier to be there and close deals than having to do things through Zoom or Google Meet, things like that. So, but also California has different telemedicine regulations. So it's one of I would say, the strictest telemedicine regulated states in the country, where you, technically speaking, you have to be physically, if you're a patient in California and you use a telemedicine service, you have to be physically present in California and speak to a doctor who's also physically present in California, even those through telemedicine, which is kind of stupid, I would say, but it's just one of those laws. And it's also kind of like in its own little world. So, but also it's a very big market for us. So, that's one of the main reasons. We will probably have an office there at least, along with the office in New York. Let's see. I'm looking at your question here, Green. Well, I can say is if that's what we sent you, then that's the case, and we will honor our word on that. The thing is, the regulatory aspect, as it's stated in the actual document, subject to regulatory approval. That's really why we have to do it, like I just mentioned. There has to be the creation of the light chain and things like that. Like it's extremely imperative that we do things the right way. Especially we're showcasing our healthcare services and the benefit they have to people and how they help people, and the transparency aspect. I mean, that really has to be the highlight of everything. And I know some people are focused on the whole MTC aspect of it, and it's valid. I understand completely. I mean, there is an enormous amount of value in that. We have to be the ones to actually show how that value is there, and show how it's good value. And that's why we have to take these steps and make sure that they're regulatory compliant. And but the good thing is, I think we have just the best plan and position to do this the right way, and to do this in an excellent way to be looked at as an example. And being a public company is a path for this, because once we're public, then we can disclose these things, and it's not really that big of an issue. So, that's why we plan on doing it this way. But yes, those what was sent to those who solicited information back then, that will still be held in the same fashion or the same terms as were proposed. Let's see. Looking at another question. Oh, so going back to what I was talking about in regards to Jamie, yes, we spent the weekend together and talked about all the things that are happening, and I think it's just going to be amazing. There's already a really, really good. There's really good feedback from everyone in the Hollywood community so far that Jamie's spoken to. So, everyone's getting very excited, and we're, it doesn't mean it's going to be easy, or it has been easy up until this point, but we have our bases covered this time. It's a lot more stable and structured. Let's see, another question here. I see Tanya's in the AMA. What is her position? Doc.com. Yes, Tanya is in the AMA, actually. Hello, Tanya. Hola, Tanya. Tanya is, she's been with us for years, and, I'm very grateful to have her on the team. And she's basically coordinates everything related to marketing and PR. She works with Jamie, and she has worked with everyone related to marketing and PR. But that's Tanya's role, and she does a great job at it. She's very, very smart, and she has experience, and she's also acquired quite a bit of experience in the last 3-4 years, and I'm sure she's evolved just as I have evolved, and everyone else in the company. But that's what Tanya's role is, and she's definitely she's been in the ups and downs of everything, and she's still held on. So, I'm very, very, very grateful to have her on the team. Thank you very much, Tanya. I'm very glad that you're here listening. So the new website is already pretty much done. The whole community has seen it already. We're just waiting on some legal aspects to get it done, so to have it uploaded. And it's that the legal side of things should be done between today and tomorrow. It's just disclaimers and things like that. So it will be done very, very soon. I've been anxiously waiting to get that done. We also put the site up for the community to see. So it will be done. There's just a couple things. We're also working on doc.com merch. So, I really want to get some merch out there, some hats and T-shirts and things like that. So at least people can get some doc.com merch and, stuff that we can use. We already have some things, but there's some really nice quality sweatshirts and things like that I really like. So we're going to have that up. That'll be another addition to the website. And actually, Tanya knows about that. We spoke about that recently. And let's see, I'm looking at more questions here. Oh, by the way, I wanted to let everyone know. I've been recently taking a very interesting course by MIT. It's a paid course, but it's healthcare and artificial intelligence. Very interesting course, and the potential is just significantly amazing. I think if you've seen Star Trek and you understand what AI is doing now, I've mentioned this before, but the tricorder has been always like a dream of many healthcare professionals, to have something such as a tricorder. And I've talked about it in several AMAs in the past, but it is truly within reach now to have something like that, of that level. Something that just, you pass by and it scans you and it tells you the important things that you need to know about the human body. We're accelerating at a very, very rapid rate. And if people have used, the Doc AI chatbot, Doc Chat, you can tell, it's getting better and better as we get more data and we specify what objectives we wanted to achieve. And there's many of them that we can do. It's world changing. And there's one particular direction that I want to take the company in. This is further down the road than just free basic healthcare. This is a grander goal. And I think this would be the first time I would ever be talking about it here. But like I've said before, this is basically my whole life has been happily consumed, I would say, by doc.com and the potential of what we have. So we started the company with the basis of acquiring data and classifying it so we could train AI algorithms and we could also commercialize that data through analytics and have revenues coming in. That was the original basis of the company. But we started the company in 2012. So 2012 was 2 years after CRISPR-Cas9 was discovered, or not discovered. It was patented, and the Nobel Prize was won for CRISPR-Cas9. I think in the year 2009, right around the same time Bitcoin came out. I'm not exactly sure it was 2009 or 2010, but I know that there was a Nobel Prize won for CRISPR-Cas9. So there is, once CRISPR-Cas9 was developed, you know, the Cas9 protein with the CRISPR method, we knew that you could edit genes with precision. And since then, in these past 13 years or 14 years since that happened, there's been lots of advances in that realm. So one of those advances is, for example, there's been a gene therapy that's gone through FDA trials so far for sickle cell anemia. If you don't know what that is, sickle cell anemia is basically when a red blood cell, instead of being round, it's actually kind of deformed in the form of like a bean. It's kind of like a half crescent moon, like a crescent moon, basically. It's the shape of a bean. So and that, what that happens is in the joints and where the blood flows, they get stuck together and they get hooked together, and that causes enormous pain. It causes heart conditions. It's just something very hard to live with. And it's a genetic mutation. So one thing with people with sickle cell anemia, using that as an example, you can find the gene. You can actually determine what gene causes sickle cell anemia. And with a CRISPR-Cas9 therapy, you can remove that gene and place the correct gene in there, so it eliminates the sickle cell effect, and the cells that are the new cells that are being produced don't have that mutated gene anymore. So essentially, in a period of, let's say, 1 to 2 weeks of getting a gene therapy, which is actually you're getting injections of CRISPR modified virus that's delivering the new genetic information into the cells and reprogramming them with the correct gene. That takes days, but essentially however long that may take, let's say 1 to 2 weeks, could be more, could be less actually. It reprograms all the cells in the body, and so the virus, the modified virus, not a bad virus, goes into the body and starts delivering its corrected genetic information into the cell. And so now the cell, when it replicates with the new information. Now, and what ends up happening, you're essentially cured forever of sickle cell anemia, because all the cells in the body no longer have that incorrect gene, and now you can now when it replicates, it's replicated with the correct gene, and it eliminates the sickle cells within the body. So essentially, you're cured of something that's a genetic abnormality or a genetic mutation. Why is that important? And how does that relate to free basic healthcare and the grander vision of healthcare in the future, and what the direction we can take doc.com? And this is actually in the master plan document that'll be on the site. I talk about this, but I'm just going to give people here, the community, a little teaser on it. So we have a basis of data capture as a telemedicine and healthcare company. We're hashing that data for transparency, but we're taking this data from people. It starts with the telemedicine services. we capture that data, as any healthcare service has to capture data. Legally speaking, you have to capture this data because of electronic healthcare rules, things like that. So that's the start. Now, second to that is for those who want to participate in a program. Let's assume we have a program. We can also take a sample of a saliva sample, and we can look at the sample and determine what genes you have. We can run that and determine your genes. And let's assume you have maybe you're a woman and you maybe had breast cancer in your family, such as my family. My grandmother had breast cancer, which she had removed. So today it's known what genes cause breast cancer, and you can go get tested and you can see if you have that gene. And if you have that gene, they recommend surgery before, but you have to get checked up on a regular basis. But the objective is we have the technology now to see the human genome. And that is very, very important. The problem is we know probably 1% or less than 1% of what each gene does in a human genome. I mean, it is an enormous amount of information. But that's changing now. And it's changing because of artificial intelligence. And genes, essentially they're 4 letters. You can use a language-based AI model, such as DocChat, to actually decipher gene sequences. I mean, it's a little bit more complex than that, but essentially that's what you can use. But where does this all lead? So first piece is data capture. The second piece is finding or looking at someone's genome. So you have a sample. Third piece is determining what genes do what. So, for example, if you send in a sample and you have the cancer gene for breast cancer, you already are aware of that. And then the fourth thing is creating a therapy to replace that gene, that mutated gene. So that's the next step. That's where you can actually turn that knowledge into actionable treatments. That's where we want to take things. And there's not just one type of treatment that we can create, but ultimately we can actually do something incredible, which is reverse aging or eliminate aging altogether. I've thought that for years, which is quite ironic with Ray Kurzweil. If anyone has seen Ray Kurzweil, he's one of the well-known futurists. He mentioned just recently, probably at the beginning of the year, that he thought because of the advances in artificial intelligence, we would solve aging in 7 years. Now, could be, could not be. Could be 7 years is a pretty short time frame, but if you understand how CRISPR-Cas9 works and what would be required to do that, you need a lot of data, and you need a lot of samples, and you need to have a technique to find what genes are either changed or no longer present in the cells as time goes by, and then a way to deliver them to create a therapy. So that is something that I've been thinking for a long, long time. As the ultimate goal, I think, in healthcare. It's quite polemic, I know, but it's also something that I think it's inevitable to happen. So the way I see it is, if we can provide free basic healthcare for the world, phase 1. Phase 2, start eliminating, diseases through therapies such as the ones I mentioned, like these gene therapies. And 3, determine what genes or what genetic information is lost during cell replication, and finding a way to replace that using artificial intelligence. There's a possibility that can happen. You can find what genes you actually lost each time the cell replicates, and then replace them with a therapy and essentially eliminate aging, which is a crazy thing, but I still think it's possible within our lifetimes, and especially now with artificial intelligence. So that's the world as I see it towards the future. And I just think that there's in the process to getting to that point, a lot of diseases can be solved thanks to science and artificial intelligence. So it is it is inevitable for this to happen. It's just who will do it. Because definitely we have access with the technology today to do it, to get on this path. So I just think it'd be amazing. I have a picture of my grandfather with me on Instagram when I was in medical school. And my grandfather passed away 2 years ago. And he was an amazing man. I admired him a lot. But I just remember him in those last days. He just looked, he was 93 years old already, but, he still was mentally fine, which is an incredible thing. I also have people on my mother's side that suffered severe dementia and things like that. And it was a very rapid process, and very, very sad to see them just, live their last days that way. But my grandfather, my father's side, he was lucid and fine, and we even played backgammon 2 days before he passed. But I just was, I remember thinking, wow, it's just such an incredible man with such such great insight and life experience, and someone very great to talk to about multiple topics. And I thought, wow, I just knew that that certain generations, my generation, or even Generation Z, or we don't know yet. We don't know who will be what generation will be the last generation to actually live before there's an actual solution to aging. And it's a very interesting thing to think about, considering all the advances that are happening with artificial intelligence right now. But I think we should be the ones to find out and really just make it for the benefit of humanity. Not really just how people think it would happen. Like, oh, the wealthy have access to that technology first, and then it trickles down to society. So there's this disparity but just make it equally accessible and available for everyone. Or whatever therapies in the process get created to that. So, it could be certain diseases, could be, there's just so many things, but that's the world we're living in now. And it's very exciting because two of the things that were always talked about in science fiction, the advent of artificial intelligence and eliminating aging and things like that. Those are truly, truly achievable things now. And the technology is there for us to do it. So it's just something that, I have in my heart, that I think that's the right path to take the company in, and use the resources that we have, that we've acquired. And in the process, we'll help a lot of people through offering free basic healthcare, showcasing the company as the most transparent company in all of healthcare, I think, ever. Not that currently exists ever. And using the beauty of blockchain for that purpose. but also, going forwards with something that can really transform the world in a even bigger way than having access to free basic healthcare, and taking the path down to do that, eliminate diseases, and potentially, eliminate aging as well, or reduce it, or just maybe even increase the lifespan of people or the quality of life. So, you know, so people like my grandfather, or anyone's parents or grandparents or themselves, can, live a higher quality of life for a longer period of time. Because most of, I wouldn't say everything, but a lot, and as we all know this, a lot of ailments in society and people and humanity are due in great parts to the aging process. And it is a natural thing. But then again, a lot of nature is created by adaptation and evolution, and sometimes we don't know why things are there as they are. But what we do know is that science has enabled us to live healthier, better lives in general. So I believe we should be the stewards to do something like that, forwards, and do it in a using a structure that's transparent from the get-go. Let's build like that. Anyways, that was just something that I wanted to mention. And but I'm excited right now that we'll be uploading the new website soon, and we'll have the master plan on there, and it'll talk about this topic as well as what we plan on doing. I like to simplify things, and that's pretty much what will be on the site. I hope everyone will be using the services more, but we're definitely planning to be launching very soon nationwide in the U.S., that's something we've never done. Actually, we got to 35 states in 2020, but nationwide launch. I can't wait for people all over the U.S. to use the services, and it's just amazing. I'm going to look at the questions here, see if there's more questions. Let's see. I'm seeing, was it my birthday yesterday? No, it was not. My birthday's in August. So my birthday is in August 19th. Same birthday as Bill Clinton. Kind of funny. Let's see. Looking at approximately what percentage of revenue? Ooh, that's a good question, Neb. You know what? That's approximately what percentage of revenue will be allocated to stakers. Well, first we have to finish the life chain. Just I know it must be annoying to some, and I can relate to that. But the fact that we have to check everything, and be regulatory compliant. And it's really not because of us. It's because of all the stupid idiots that made did very bad things in the blockchain space. But it's understandable, it happens when new things are out there. But first, we have to ensure that the life chain is well. Second thing we have to do is, it's created correctly and it's up and running. So that's not too far away from now. The second thing is we have to be listed. And then after that point, which is, 90 days away roughly, then we can create actual smart contracts and do staking and things like that. But we would have to disclose that. So once that's disclosed, that's fine. And we had originally planned to do around 4% under this model. Then again, that could change. But right now is not the moment to decide the actual percentage. Just know that it'll be a significant amount, and it'll be dependent on different factors, because it's not just the staking aspect that we considered in the past. It was also the rewards mechanisms. Like the rewards mechanism can take a percentage itself. So pulling it together, all the blockchain components, is a correct way to determine percentages, to see what goes to what. But ultimately, it'll be based on what increases our engagement with users. So if a user, for example, does a call every 2 months instead of every 6 months or every 3 months, there would be a reward incentive there. Will that user use that to? Will that patient use that to pay for medication? Maybe it's someone that doesn't really need medication that often, so they just have it. They just hold it. That would be a good candidate for staking. And these are great ideas. We've been talking about this. They're just amazing things that can happen to maximize value for all patients and to reduce costs in healthcare in general. Let's assume someone uses a service a few times and then goes months without using the service, and then suddenly something happens and they need to buy some medication, and then they have their MTC. They were rewarded, but that's been staking during that whole time, and it got some grew in value. That would be amazing to be able to take that value and put it towards a purchase of a medication. These are truly good things that will benefit patients in the end and reduce their costs. So the focus is on achieving that goal. But we have to do it under a regulatory environment that's favorable towards our cause and that is aware of what we're doing. And so we still have to wait to get to that point post listing to execute on these ideas. Even though we planned everything out and we have the development capacity to do these things, there's still that component. And ultimately, we want to do things that take us to achieving the objective of providing free basic healthcare for all and having something that's sustainable and scalable worldwide. That is the goal above anything else, to achieve that. And so whatever we do to achieve that goal will increase. And I've always been an advocate for using anything blockchain related for transparency, for rewards, for improving the business model. So, that's why we have team members fully dedicated on that. Daniel's going to lead that aspect of it. We've been talking about these ideas for years. So the short answer is yes, there will be percentage, but once we're able to disclose how it'll actually be executed. And the long answer is what I just said, everything that I just said, basically. So yes, but we have to wait on compliance once we're listed, and it can be a series of multiple things that are not only just X amount of revenue goes to staking. It should be a combination of utilities. We have to increase the utility in the most aspects as possible with MTC. So it's not only just staking, it's not only rewards, it's not only hashing. We have to find more things. The more things we find that increase the hash rate, the amount of hashes, the transaction rate, the more utility it has, the more intrinsic value it gets. And that's I've talked about this in some of my speeches in the past. What does intrinsic value mean? Intrinsic value means that it's essential for something, and that's how we have to make this. essential for our transparency that there's a hash. That's the utility, the base utility of the token. It's essential for rewards within the ecosystem. All decentralized aspects of it. So all these ideas we've talked about, and the community has talked about it. We've talked about it together. There's many posts about it, but it's consolidated within the white papers and that we wrote about the LifeChain in the past couple of years. Daniel was part of that document. I think we shared it to the community. I believe we did. So some of these concepts are in there, and they're very clearly laid out. And the beautiful thing is it's not something that's too complex to develop. I mean, still, we have a great development team, but these things can be executed relatively rapidly. It's just the regulatory aspect that we have to be very aware of and cautious of, so we don't affect our true mission, which is to provide free basic healthcare. Let's see. Looking to see if there's any other strong questions here. Anything that looking at Quentin's questions. Thank you for Quentin for being on again. Let's see. How was the soft launch patients? It's been very good. I think I scrolled past. Okay, that was 127 today. It's been good. It's been good so far. Really, it was designed so our doctors get back into the momentum of giving consultations. That are definitely working well. We've had people of all types use it, and it's not new that we knew people love the kind of service. It's just so easy to use. And the last AMA, when I displayed the service, people saw how simple it is. It's just a one-button press in the video chat. But really, the soft launch shows that we can do what we set out to do, and that's very important for everyone that's invested in us. The next thing right now is launching the site. And starting to promote the site more. So that's what's going to happen shortly, the next days. So that's the next thing. And I think that'll also increase the amount of patients we see per day, but we haven't really done much marketing yet. And the reason being, we have to wait until the filings are done to really start pushing a lot of marketing and PR out. Because once the filings are done, that's it's made public. We're very close to that happening as well. So the sequence of events is we upload the new site with the chatbot, which the community has already seen and participated in using it, giving us feedback. We do the filings, and then we start the campaigns, and then that leads up to the nationwide launch in the U.S. and the listing. So that's pretty much the roadmap for the next 90 days, roughly 90 days. So that's how we have to do it. There's no use in wasting, advertising money right now if it's pre the filings. But we definitely have the team prepared, and that was the purpose of soft launch, was to show our investors, hey, our tech is built. We do have that. Our healthcare professionals, doctors and psychologists are working well. We are getting users in, but they had to get back into it, and it doesn't take a long time, but that first couple of weeks, month long process is always beneficial to review cases and to see optimize from a services standpoint. When it is expected to show financial reports? Okay, so that's a great question. I'm seeing Ellie's questions here. trying to see if these questions are from. Okay, so they are good. They're from recent. Okay, so we with our pro forma model, if you look purely at our financial model pro forma, purely doc.com, we would get to profitability at the beginning of year 3, and that is focused on launching only 5 states. So that's actually what we use to raise capital. To raise a capital, we use that model because even then, it's still a reasonable amount of time to reach profitability. So we said we spend money throughout 2 years to get to profitability in year 3. We need X amount of millions of dollars to achieve this goal, and that's how we raise capital. So since then, there's been significant changes. There's been the major changes. We're doing a nationwide launch, so that's going to increase our growth numbers. And the second thing is we're also launching other countries as well, not just 5 states in the U.S. So we just did our soft launch in Mexico, so that also increases the numbers there. So I believe we'll reach profitability quickly. And then there's a third component that wasn't taken into consideration into the financial model, which is acquisitions. So I'm working on with the team. We're all working on acquisitions, so we can come out as a listed company and already be profitable through acquisitions. So, and those are, we plan on doing many acquisitions down the road to vertically integrate our pharmaceutical component of the company and do it and produce our own branded drugs, things like that, to vertically integrate that as much as possible. So officially speaking, we get to profitability on year 3. That's what's in our financial model. It has changed because of those 3 factors. The expansion plan has increased dramatically, and we also have acquisitions that we've been working on. So the objective is for us to have profitability very, very soon after listing or at listing, and that's how we plan on doing it. So those are great questions. And when we'll be show reports, we'll be a public reporting company. So we should be doing our reports, quarterly reports, just like any required public company. That's pretty much it. We have that down. It's planned. And is the stock still listing mid-summer? Yes, that is the plan. That is a plan right now for it to list. Obviously we'll know after the filings are done, but that's the path we're on right now. Let's see. Looking if there's any more other questions. I like the hard questions sometimes too, so throw them out there. Besides adding value through hashing, what point do you decide to buy back MTC? So that's another good question. The LifeChain is doing that. That's it's important to consider that the LifeChain is doing that. And essentially the LifeChain starts with a quantity of 0. So, it has to buy to offer the hashing services. So I would say the LifeChain would be doing that pre-listing. So that's the answer to that question. I'm looking at the other questions here. Can I get a Doc t-shirt? Yes. I hope to be wearing one on every single AMA after this too. And we'll get some soon. How has the role of the blockchain in Doc.com LifeChain ecosystem changed in the recent vision? Well, I think that's a good question, Armin. The role is still the same because transparency was always something very important. Let's say from day one when we said, okay, let's go about creating a blockchain crypto economy. That's what we started with. And if you look at the AMAs from years ago, we used to talk about the benefits of it. That's all those components are still there. I think the way the way it changed was, over the course of the years, the whole regulatory aspect has changed. So it has to be the life chain now. It has to be a foundation. It has to be function in that way. And Doc.com is just hiring a hashing service, essentially. And so in that sense, it changed. But the actual objective, the purpose of having blockchain has been for transparency and to create value. And that value should be able to help subsidize or reduce the cost of healthcare, not just telemedicine, healthcare in general. So those two key aspects of the vision have always still stayed the same. It hasn't really changed. I think besides that, it just changed structurally from a regulatory legal standpoint, because the regulatory legal aspect of it has changed. That environment has changed in the last years, and so in that sense, it's changed. But the original purpose of it is still the same. Blockchain is just a technology. It's how you use the technology that really is the benefit. And really, one of the key virtues of blockchain is transparency. There's really nothing more transparent than a blockchain in the digital world, than a blockchain hash in the digital world. So that's it's something that's incredible, and I still think people still don't value it, the significance of it. I mean, you could solve voting with blockchain. It's still amazing to me that politics or the bureaucracy has not allowed blockchain to be heavily implemented into voting, but you could solve all the voting drama that we see with blockchain technology. But we always said, hey, we want to, every time we give a consultation and there's data captured, we hash that on the blockchain, and that has always been what we've done, and that's always been the vision as well. So I think just the regulatory aspect has changed. Let's see. Going to the next question. Let's see. Will the marketplace be available to those who are holding MTC to access and purchase with their tokens? Yes, I mean every that's a good question, Quentin. So the user experience should be, you log into the app or the website, you are able to use either a chatbot or initiate a call with a doctor, and you can purchase a product. If you get a prescription, you can purchase it in the marketplace. If you have MTC, you should be able to use that towards your purchase, and therefore reduce the cost of your purchase. So that is that's how it could happen. Now, by using the services, you can also be rewarded with MTC. That's how it was always planned. Just the same way you get rewarded in a traditional rewards program, American Express, things like that. You get rewarded based on your engagement with the platform, and so you can use that MTC towards a purchase of a medication or a partial purchase. So you can use it, and that's the baseline use case. But there are other things that can happen as well. We could go deep into the staking aspects of it, but then again, you start kind of playing around with all the regulatory aspects of it, and so it's not to say that we don't want to do that. It's actually I think would be beneficial. But then again, we have to consider the regulatory aspect of it all. So, I just believe that we should do things that are in the end benefit to people and to patients and the users themselves, and that it will be the ultimate decision maker. And try to do it as in the best way possible. I think that's we have a good plan in place right now. I'm very confident with it. Let's see. Richard, thank you for your comment. Yes, I've been actually I just had a couple of rough days after the food that I ate in LA, but I'm all good and getting some good sleep and working. Let's see, Ellie, Flashgas still proceeding with their public listing. Yes, they are. So two things. Flash, they're their own team and they're growing and they're doing very well. Flashgas. That's a question by Ellie. They're also going to handle some of the additional delivery options for Doc.com oxygen delivery. They actually started promoting that recently, promoting oxygen delivery. In I think they had 35 orders the first day or something like that. They told me. But yes, they are proceeding on a similar path as well. So definitely they're on path, and it's a great team. I think Alex created a group as well for Flashgas, and that's something that people can go on there and ask questions directly. What happened to Valor? Valor Studios is still up and active. The only thing is because of the regulatory aspect, we decided to change a little how the next steps go. So instead of launching tokens for projects that were blockchain based, with all the things that happened with the whole FTX scandal and everything, everyone got really, especially the people, they started asking, well, where is this going to go? So what we ended up doing is we put from the funds that I obtained for Doc.com, we actually put a fund within Doc.com to invest into projects that increase the user base for Doc.com and free basic healthcare. And there's 3 projects in there that are receiving funding from the Doc Fund, one of which is Valor. So they're essentially waiting for that funding to execute the next stage. And Valor already has in this past time, there's a metaverse project that was that's in the pipeline. There's a project in Africa that's in the pipeline with Valor. There's several things that the work was already done, and so that's essentially what Valor has in the pipeline. But basically, they're waiting on the funding to get to the next stage, and that funding is coming from the funds that we got from Doc.com. It's not something I'm not involved in the operations of Valor Studios. Felicia runs Valor, but essentially Valor is functioning as an incubator slash venture capital fund themselves to achieve the mission to help underserved communities and founders from minorities in underserved communities. So that's the objective of Valor Studios. And there's just an enormous amount of people that reached out through the website and also that need it, So that's the plan with Valor. It's just we don't want to, we're US based, and so that it's very important for us. I'm kind of the Warren Buffett mentality. There's a good picture of Warren Buffett where he's standing next to an enormous stack of papers, and he says, "Oh, these are Berkshire Hathaway's tax papers, tax filings," and it's just like, wow. And he actually says it not with a negative, not with a negative connotation, but in a positive way, because he says, we happily pay taxes, because this is a great country. And, I'm from Mexico. I love Mexico, but I'm also American. And, we have people from all over the world here from the community, but I do see, because of the contrast of living in Mexico for the past 16 years and then coming back to living in the US, I see there's a contrast. And, no country is perfect and every country has its issues, but the US has certain qualities that I do appreciate. And because of that reason, I want Doc.com to be an example of something that's very positive in the US, so that includes Valor Studios or any project that I'm involved in. I would want that. I will want it to be a high quality, something good. We haven't gone through so much suffering and pain if it's not of high quality. So the thing is, when you delve into the blockchain space, then you have all these, all this FUD and all this, uncertainty, and people saying bad things about everything crypto related and blockchain related. And there's this ups and downs and highs and lows, and people go nuts, and then they want to come in, and it's just, and I get asked a lot about that. And I think, well, we have Valor is set up as a Wyoming DAO LLC. So it's a Wyoming DAO. And it's a U.S. entity. And it's, obviously we've taken the path to do it the right way. But just the fact that if you do anything related to the creating a new token or something, you're on this, I think the SEC still needs some time to figure it out. And because of that reason, I mean, with all the things that are happening, people have to still be cautious. So I believe the best path for us to take is just to do things the right way, to do things where we can prove that they're beneficial. And if the projects need to be funded through a different mechanism, that's fine. There's nothing wrong with that. In the end, there's investment that needs to be done. So that's how we planned on executing the next stage of Valor Studios, and the path that we set out for Doc.com as well, and the life chain. Well, I'm seeing here a question. Let's see. I'm sure this has been asked, but will MTC tokens on Bitrue be automatically converted into the new token? Well, first of all, we don't even know if there's going to be a new token. That's an important aspect to consider. I mean, I got a response back from KuCoin, by the way, and it looks like we'll be able to offer the community or everyone just really to a lower exit cost from KuCoin. We should know that by probably Wednesday of next week, and I'll announce it to the community here. There was just one other thing that I was waiting on the response from. But if that's the case, then we'll be able to remove all the tokens from KuCoin. And there's a significant amount in there. So there won't be a need to issue a new token. Really, we're trying to, there's not a real benefit in issuing a new token in general. So, but if that were the case, the conversion would not be automatic. You would have to actually send the tokens through a bridge, and they would, once they're sent over through the bridge, you would actually get sent back, or you would convert at that moment. So yes. So if you do it through the bridge, then they would convert, but you would actually have to do that. But if you have your tokens on Bitrue, then Bitrue would handle that for you. So it really wouldn't, there wouldn't be any negative aspect that you would have to worry about. Would working with nonprofits, as Red Cross has mentioned prior, be considered in the horizon? Oh, yes, of course. Anything, we can work with nonprofits or governments. We can definitely work with anything like that. But I would say there's a lot of good that we can do ourselves directly, and sometimes nonprofits are not necessarily the best groups to work with. There's nonprofits that have gotten billions and billions and billions of dollars in funding and have done less than many for-profit companies. So it just depends on which ones. Red Cross, I'm a fan of Red Cross. I actually have experience of being at Red Cross during medical school and saw the amount of work and effort. They're constantly in need of funding, that's for sure. But also there's, I think we can build a good relationship where they get benefit and so does Doc.com. And that's the basis of what we've been working on. Okay, everyone, I extended 18 minutes more. I actually have about 12 minutes to get to my next meeting, prepare for it. I'm going to end the AMA today here. Thank you so much, everyone, for giving us your time and great suggestions. Please, if you think of other things, ideas, suggestions, things where we can improve, please let us know on the community. And Tanya's listening, but we'll be sure to take notes. Also do polls. I know that I spoke about this previously. Right now we're doing the AMAs here. We should run polls and just have a database of these decision making. So I'll ask Tanya to get this done, and so we can take these questions and see if we make the switch to Twitter Spaces for the AMAs and increase our audience. And that's pretty much it. I wish everyone an amazing weekend and enjoy these beautiful days of spring and summer. And thank you so much for being here and being part of this amazing journey. It's because of you that we've been able to help so many people and have such a beautiful project going forwards. We couldn't have done this without all the support. And that's, I say that truly from the heart. I'm not just saying that just to be nice. I really do say that it's from people from the community who invested, who were always supportive, and it has been of great help. So I'm very, very grateful for that. Thank you so much. Thank you, everyone. Speak soon. Speak next week, and looking forward to the new site being up soon as well. So have a great weekend, everyone. Goodbye.